Good evening to all of you who are joining us for this special Peel Region Municipal Election Forum. My name is Daphne Nussbaum. I am the Program Coordinator and Analyst for the Peel Alliance to End Homelessness and your MC for the evening. I would like to begin with a land acknowledgement. I acknowledge the land on which we gather and which the Region of Peel operates as part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. In particular, I acknowledge the territory of the Anishinaabeg, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa people, the land that is home to the Métis, and most recently the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. I also wish to thank all of the organizations that came together to develop this event, including Ontario for All, Mississauga Food Bank, Advocacy Centre for Tenants Ontario, Peel Poverty Reduction Committee, Peel Alliance to End Homelessness, Canadian Centre for Housing Rights, and the Anti-Black Racism and Systemic Discrimination Collective. Before we officially kick off our panel discussion, I'm just going to go over the agenda and review some housekeeping items. So the municipal election, or this municipal election, we are calling on all candidates to recognize the most pressing issues that Peel residents are facing. This evening's forum is a panel discussion featuring experts who are here to speak on the housing crisis, income supports, and equity. We have three panelists. They include Douglas Kwan, Director of Advocacy and Legal Services for Advocacy Centre for Tenants and Housing, Deborah Kobluk, Senior Policy and Analyst for the Income Security Advocacy Center, and Angela Carter, Executive Director of Roots Community Services. There are three moderators, one from each of the partner organizations, who will ask the experts questions in a 15-minute time frame. Once the panelist discussion is complete, we will move into the audience Q&A and then wrap up the event around 8 o'clock. We also have a welcome address by Daniele Zanotti, President and CEO of United Way GTA. And now for some housekeeping items. First and foremost, please keep your microphones off so that we do not hear any background noise during the discussions. While panelists are speaking during the first portion of our event, they will be pinned or spotlighted. So if you look at the speaker feature on your Zoom screen, you'll know who is speaking. The pin application will not be used during the audience Q&A, but again, if you put it on speaker view, you'll be able to see who's speaking. You are welcome to submit questions during the presentations for panelists through the chat feature. You can use the drop-down menu in the chat function, and there are two options. One, for ask a question, which is where you can pose a question for any panelists you hear this evening. And the other item that you can ask a question for is tech support. So again, there are two features. One is for asking a question for the panelists, and the other is for tech support. Both are in the chat functions. We will do our best to get to as many questions as possible. I will ask the questions you have submitted to the panelists. There is a closed caption that's enabled for this event. So if you have the feature on your Zoom account, you can access it by pressing the closed caption button if it's set up. And now on to our event. So it's no secret that Peel is in the midst. Oh, and I'm so sorry. I just wanted to mention that we are going to be introducing Daniele very shortly. I just wanted to sort of get as much in before this, but it is no secret that. Oh, okay. So it is no secret that Peel is in the midst of a homelessness and affordable housing crisis. Many residents are feeling the pinch of inflation, and those who rely on social assistance have to make a decision between paying rent and buying food. There is a need for adequate funding in all critical service areas, including health, education, gender-based violence, supportive housing, addictions, and mental health services. We also have a glaring systemic issue with reporting and accountability when it comes to action on equity, anti-Black racism, and systemic discrimination. Our elected officials have a responsibility to understand the existing and ongoing challenges and act to ensure that all residents of Peel have access to a better quality of life. I thank you all for coming today. I also recognize and thank the municipal candidates for joining us this evening to listen and understand the poverty landscape in Peel. Now to our welcome speaker. With his 20 years of experience in the public and nonprofit sectors, Daniele Zanotti's work is guided by one core value: to work in and with community across all sectors to fight local poverty. Under his leadership since 2016, United Way Greater Toronto is now the largest United Way in the world and largest funder of social services in the GTA outside of the government. Daniele holds a Master of Social Work from the University of Toronto and sits on advisory committees and boards across the region. Welcome, Daniele.
Daphna, thank you for having us and for your wonderful words of welcome around the issues that are structural and systemic across Peel. In the 1800s, Joseph de Maistre, a French lawyer and diplomat, said, "Everyone gets the government it deserves." In 2021, at one of our community meetings, Sylvie, a resident in Peel, living with chronic health issues, working 3 jobs to stitch together rent for a tiny moldy basement, said, "I deserve good housing and a good job in a good neighborhood. And everyone running for elected office deserves to hear about it." That's why we created the checklist for voters to consider, based on priorities we heard from citizens in town halls, from our network of 300 agencies delivering frontline services every day, from the 2 million people, neighbors, family, friends, who accessed a United Way agency in Peel, Toronto, and York region in 2021. A checklist of community priorities: affordable housing, good jobs, strong neighborhoods. So that in discussions just like this tonight, this local, intimate, faccia a faccia, whether it's live or virtual, each of us, from wherever we sit, settlers all, with and in any of our privileges, can build our awareness around the systemic and structural issues that started, sustained, and left unaddressed will keep far too many stuck in stubborn poverty in Peel, so that we can share experience of how poverty lives in Peel neighborhoods, and then shape together, citizens, candidates, elected officials, the very building blocks we all need to thrive, regardless of postal code, race, immigration status, faith. Thank you, citizens, for coming to give voice. Thank you, candidates, for coming tonight to listen, learn, and commit to leaning in on these critical community priorities. Peel deserves regional and local governments committed to working with community, faccia a faccia, in a united way, building a healthy, equitable Peel that is great for all.
Thank you, Daniele. Very inspiring words. I don't think I've ever heard faccia a faccia. I am going to if you can put the or give someone the what it means in the chat, and then I will I'll use it moving forward because I know what it means. But thank you so much for that. You raised some really important points. Critical community priorities is what we are very much focused on right now, and these need to be obviously addressed, which we will be doing in tonight's discussion, as well as hoping that this gets you excited and motivated. So now I will move on to our first panelist of the evening. So home is at the center of human rights. Without adequate, accessible, and affordable housing, our other human rights such as equality, liberty, dignity, privacy, freedom of expression, and even life are threatened. All levels of government have the obligation and ability to respect, protect, and fulfill the right to adequate housing. Peel Region is also experiencing a homelessness and affordable housing crisis. As of mid-September, 750 people are living in Peel-based shelters and 200 people are living in shelter and overflow hotels. This number does not include people who are living rough or have precarious housing, or sometimes known as hidden homelessness. I now welcome Sean Keddy from the Canadian Centre for Housing Rights to introduce our first expert, Douglas Kwan, and moderate the discussion on housing. Thanks, Doug and Sean.
Thank you, Daphna. So I'm Sean Keddy, and I'm the Manager of Stakeholder Relations at the Canadian Centre for Housing Rights. We're formerly the Centre for Quality Rights and Accommodations, or CERA, and I'll be moderating the housing portion of tonight's event. So housing is one of the most pressing issues that Peel residents are facing. Across the housing spectrum, from homelessness to affordable home ownership, residents are finding it increasingly more difficult to find affordable, adequate housing. While all levels of government must work together to address housing issues, the municipalities should be taking an active leadership role. That is why we are asking all candidates to commit to making tackling housing a priority over their next term of council. So our first speaker will be providing some insight on the severity of the problem and the actions that municipalities can take to help mitigate this problem. So without further ado, I'd like to introduce Douglas Kwan. Doug is the Director of Advocacy and Legal Services at the Advocacy Centre for Tenants Ontario, or ACTO. ACTO is a community legal clinic with a provincial focus to provide legal services to low-income Ontarians to ensure that they have safe, adequate, and affordable housing. Prior to joining ACTO, Douglas worked at Mississauga Community Legal Services for 16 years in progressive positions, from staff lawyers to co-executive director. He has extensive experience practicing housing before various administrative tribunals and at the appellate level within our justice system. He has also taught community agencies and practitioners on housing. Douglas has long promoted safe and affordable housing policies with decision makers and communities because he strongly believes that great communities start with engaged communities. So I'd like to welcome Doug, and thanks for joining us.
Thanks, Sean. It's a pleasure to be here.
So I guess we could just jump into the first question, if you're okay with that. So first question is, what does it mean to be in a housing crisis, and are we in one now?
So there's three signs that tell us that we're in a housing crisis. We're seeing that tenants are unable to move. They're unwilling or unable to assert their rights. They are bearing a housing situation where there might be maintenance issues because they want to keep their affordable units. The second sign of an affordable housing crisis is that landlords are increasingly turning to no-fault evictions to remove long-term tenants who are paying their rent because they want to capture a higher rental costs for that unit. And the third sign is that tenants who want to move can't find a similar sized unit elsewhere without paying a higher rent or paying the same amount of rent, but selling for smaller size units, or having to move outside of their community altogether. So those are some signs that we're seeing that we're in an affordable housing crisis. Furthermore, in Mississauga, we've seen rent go up by 25% over last year. Rental units are being offered for $2,800 a month. And Mississauga happens, and that 25% increase happens to be the highest level of increase in any GTA municipality.
Great. Sorry. So I guess as everyone's well aware that the many impacts that COVID-19 pandemic has had on us. So would you say that this housing crisis is a result of the COVID pandemic, or were there signs of this crisis prior to the pandemic? Do you see it, any of these issues subsiding now that we're kind of hopefully at the end of this pandemic?
Well, unfortunately, we have been trying to tackle the affordable housing crisis prior to the pandemic, and the pandemic has simply just exacerbated the crisis itself. Prior to the pandemic, we've seen vacancy rates in Mississauga and Brampton hover around 1% to 2% for almost a decade. And CMHC, the Canadian Mortgage and Housing Corporation, determines a healthy rental market being 3%. 3% is a situation where tenants have more choice as to where they can live, and a little bit more negotiating power as to how much they're paying for that rental. And we haven't seen those numbers for over a decade. And as to whether we're going to see an improvement on affordability, that remains to be seen. And I think this discussion that we're having tonight is going to be part of that solution, where voters can talk to their candidates about what they can do to fight and improve the lives of many people who are looking for affordable housing.
Okay, great. So while the pandemic might not be the actual cause or of it, it has kind of exacerbated it. But aside from that, so what are some of the actions that the municipal government within Peel can take to address this housing crisis?
Well, I think the general conversation that most people hear is the provincial and federal government using their levers to incentivize more housing supply. And although increasing housing supply is important and they have a lot of tools in their toolbox, municipalities also have have tools themselves in zoning and bylaw powers. And we see those tools in action, whether it's to keep our environment clean or our neighborhoods safe. So some of the tools that municipalities have done and have implemented in the past have been, for example, in Mississauga, they're implementing the Rent Safe pilot project, where large rental buildings are proactively inspected by the bylaw office to ensure that they maintain a habitable state. We've seen municipalities increase incentives for affordable housing and home ownership, and also to ensure that secondary suites are licensed. We've seen municipalities advocate to make sure that they get the right data to combat the rent eviction issue that we're seeing across Ontario and, in fact, all over the country. We've seen municipalities also work and support nonprofits and co-ops to make sure that they can compete with private developers to make sure that we have affordable housing. We've seen inclusionary zoning, short-term rental bylaws to address the Airbnb situation out there. So there are a number of tools available for municipalities to incentivize and to preserve our affordable housing stock.
Great. So the municipalities actually acting on and implementing these tools, is it more just a matter of political will? And are there specific actions that they can take where they won't require buy-in from provincial, federal levels of government?
Partly, of course, you want to work with all levels of government, because then your impact is just going to be that much greater. And certainly we've seen municipal governments act quite forcefully and strongly to try and tackle the affordable housing crisis. There are certain things that municipalities can do on their own. Some municipalities have implemented a no parking minimum bylaw or position, where new developments, the builder actually determines how many parking spaces are needed. And in that way, it creates more units. And those units tend to be a little bit more affordable. And it also reduces congestion because you have fewer cars. I think there's been a lot of study on that piece where in major urban centers, not all the parking spaces are being used on our new developments. So that's one possible tool. Another tool could be the idea of exclusionary zoning and tackling that, where single detached homes can only be replaced by another single detached homes. Municipality can put in a bylaw to say, well, instead of only a single detached home being to replace another one, perhaps there's room for a duplex or a triplex to increase density and make housing more affordable. Short-term rentals, that has been something that both Brampton and Mississauga has passed bylaws on, and that those bylaws have ensured more safe housing, as well as incentivized or create more long-term rentals available for residents. So those are a couple of things that municipalities can do on their own without the province signing off on some of those initiatives.
Okay, great. So I wanted to focus on one specific policy tool that the cities have at their disposal, and it's gotten a lot of media attention lately. It's the city of Mississauga just passed an inclusionary zoning bylaw in August. How will that affect the housing crisis in Peel?
Well, I think it's one tool in the toolbox that will help make home ownership more affordable. It specifically concentrates, looks at developments around major transit areas to incentivize developers who are building in those areas to include affordable home ownership. And the rules in place will make sure that those units maintain their affordability for 99 years. And so we're seeing a lot of major transit development, whether it's BRT, the LRT along here, Ontario, and those areas that are ripe for redevelopment. And so it's important to make sure that that those older buildings that are housing people, that provide affordable housing, maintain that affordability. So it's certainly a useful tool. The one concern that we have is that for rentals, affordability will only be for 25 years. And the Provincial Residential Tenancies Act has a provision where it says any new rental that first occupied after November 2018 will be exempt from rent control. So we're concerned that even though the aspiration is to make sure that those new rentals are affordable for 25 years, having no rent control on those new buildings, the city of Mississauga is going to have a difficult time to maintain affordability.
Okay, and what about the other municipalities, Brampton and Caledon? You mentioned that like City of Mississauga has implemented the inclusionary zoning policy, but is this a regionally wide policy that's going to be implemented?
It's my understanding that Brampton's looking into it. They've completed consultations on inclusionary zoning, and they're in the process of developing their policy. Caledon, I understand, doesn't have or hasn't, the province hasn't designated any major transit areas for inclusionary zoning to apply. So it remains to be seen what opportunities are in Caledon that municipal councillors have to really incentivize affordable housing. It's something that eventually every municipality is going to have to deal with. And it's important that those lower tier municipalities work with the region to make sure that we have policies in place that that are uniform and can be applied throughout the region of Peel.
Okay, great. Thanks, Doug. That was it for my questions, and kind of got to keep to a time schedule. But thanks a lot for all that great information. And I would encourage everybody on this call to type any housing related questions into the chat so that we can kind of get to them at the end of this, the end of the presentations. But for now, I'm going to pass it back to Daphne, who can then now introduce the next section of this forum.
Thank you so much, Sean and Doug. It's a really, really good, important discussion about how municipalities can basically enable more affordable housing in municipalities. In fact, municipalities are probably more important when it comes to policies around affordable housing. And I think that there's some really good takeaways from the discussion that Doug and Sean presented. And again, it's something that you can always do some research on, but it's always good to know what the options are. And if you do have any questions, there's nothing wrong with getting in touch with your local councillor or candidates who are in your ward. But once again, thanks for that. And I am now going to go into the next section of our presentation. So the Government of Ontario has initiated a modernization of social assistance, which includes several changes to Ontario Works and the Ontario Disability Support Program, so OW and ODSP. Some of the concerns around this include how municipalities will take responsibility for getting people access to supports, how people can afford living on OW allocation, which is just $733 a month, and how can people with disabilities seek employment with incomes 40% below the poverty line and need devices and supports to enable them to work. Christy Lynn from the Mississauga Food Bank will now introduce our next expert, Devorah Kobluk, and moderate the discussion for the next panelist on incomes, or our panelist on income supports. Thank you.
Thanks, Daphna. Hi, everyone. My name is Christy Lynn, and I'm the Director of Strategic Initiatives at the Mississauga Food Bank. I'm really excited to introduce our next expert today to talk about social assistance, because actually 1 in 3 food bank users relies on social assistance as a main source of income. So unsurprisingly, food bank demand rose drastically at the start of the pandemic, and some of you may not know that it has only continued to climb since then. And we know that food bank use and social assistance rates and poverty are all very closely linked. So this evening, I'll be talking to Devorah Kobluk, an expert on the topic of social assistance in Ontario. Devorah is a senior policy analyst at the Income Security Advocacy Centre, or ISAC, which is a specialty clinic that is part of Legal Aid Ontario. Before she joined ISAC, Devorah was a staffer on Parliament Hill, where she managed communications, and she collaborated with numerous community organizations and Indigenous nations on policy review and development, specifically related to energy, the environment, and also seniors. Now at ISAC, Devorah's focus is now on social assistance policy, and she also has a special interest in advocacy for people with disabilities. So Devorah, thank you so much for taking the time to speak with all of us today.
Thank you for the introduction, Christy, and to the organizers for the invitation to speak. Happy to be here.
Yeah, happy to have you. So I'll start with a general question that may hit home to a lot of the people listening today. During the pandemic, can you speak to what trends we've seen in inflation and the cost of living, and how has that compared to trends in income supports?
Sure. So what we know is social assistance rates have not kept up with inflation and the cost of living, and this is nothing new. It's been for quite a long time, almost 3 decades. Since 2018, when the rates were last frozen, there has been overall approximately 14% inflation. The modernization of social assistance is not including a rate increase that Daphna mentioned in the introduction. And hopefully Sean can put in the chat the link to ISAC's most recent rates sheet, where you can see the breakdown of social assistance rates by family size and household. But the summary I'll give here is for unattached singles. And I do that because they are the largest group of recipients. So what we know is 61% of people on Ontario Works are unattached singles, and 79% of people on the Ontario Disability Support Program are unattached singles. And I just want to break down that $733 rate a little bit more. So Ontario Works did not receive a rate increase in the recent budget. People on Ontario Works received $343 for basic needs and $390 to fulfill their shelter needs. And this does leave them 40% below the MBM, which is the market basket measure, or one of the accepted measures of poverty in Canada and in Ontario. So just to give you a sense, when you are at 75% of MBM, that's considered deep poverty. So people in OW are actually 40% on 40%, so 60% below of that. So we're talking about people who are living in really, really deep poverty. ODSP did receive a 5% increase. If some of you have clients in your lives, you'll know that their check last month was slightly higher. Now they receive $706 for basic needs and $522 for shelter, for a total of $1,228. But this still leaves them at 60% of MBM, or 40% below the poverty line. Now, on the other hand, in 2021, we know the average rent in the region of Peel for a bachelor apartment was $1,063. And for a 1-bedroom was $1,424. So we can see those shelter amounts are grossly inadequate. In August 2022, the Consumer Price Index showed that the price of food is rising by almost 11%, which is the fastest since 1981. And I know many of us have felt that at the grocery store. So the basic trend that we need to be aware of, that I don't think will come as a shock to anybody, is that the inadequate social assistance rates are making it virtually impossible for people to meet the costs of their basic needs. And these include housing, food, transportation, digital access, childcare, and extra costs associated with living with a disability.
Thank you. Two things that really struck me from what you said. I think it's so interesting that you focused on unattached singles, because that is also the largest growing segment of food bank users. We're seeing that group rise time and time again, year over year. And also the rates that you shared for ODSP, those are after the 5% increase.
Yes. Yeah.
Still extremely low. So that is
very low,
really alarming. Okay, so my next question, a bit more about what the government can do. So most income supports are at the provincial level, a lot of what we just talked about. So what can the municipal governments in Peel do?
Right. So when people cannot afford food and shelter, they land up using the services of municipal governments that municipal governments fund. So things like the shelter system, food banks, and other community support programs. The municipal government supports many of these social services with grants and funding, or administers them directly. So it is therefore in the best interest of municipalities to advocate for higher social assistance rates that will bring people out of poverty. And I think also, so there is a cost sharing between the province and the municipalities for people living in poverty. I don't think people who are living in deep poverty can afford kind of the interjurisdictional battles of it's another level of government's responsibility. We really do need full cooperation at this point. One thing I'd like people to know is this is a particularly interesting time in the rates, because the provincial government has saved almost $800 million during the pandemic in social assistance costs because of the lower caseloads. So this means that not only can they afford to give an increase to both OW and ODSP, but they can afford to give more than a 5% increase. So I would encourage people at this time, as we go into the municipal elections, to raise that number and say, you know, this is actually a time where you have the money to reinvest. You won't be actually going into the red to do it.
Interesting. Yeah, that's a great point. So one thing specifically that I wanted to ask about is if you could tell me a bit about the employment services transformation rollout in Peel.
So as part of the modernization of social assistance, which is currently ongoing, the province has separated employment supports from the rest of the social assistance system and integrated employment services with Employment Ontario. So while there are opportunities for reform, as it stands right now, the concerns do outweigh the benefits. Ontario's current version opens the door to the possibility of international and private managers overseeing local employment activities, and this will mean a loss of control for municipalities and communities that will carry the cost of poor job placement outcomes. This is exactly what happened in Peel Region in February 2020, when WCG, a private firm from Australia, was chosen as the Service System Manager, or SSM, to oversee employment service delivery in Peel, which was one of the first 3 prototype regions. Interestingly, this province has already tried this model in 2008, also with WCG. And in that pilot, at the 18-month mark, only 13% of clients had permanent jobs. So it wasn't very successful. The model uses a pay-per-performance model, which is where the SSM is paid based on the number of clients it places into employment. So that is the incentive, is to get people into employment rather than get them prepared for employment.
And this pilot is the same structure as the previous one in 2008 that was not so successful.
It's similar, and it's not a pilot, it's a prototype, which means they're not stopping and studying. They are powering through to the next round in the province. But it is, Peel was one of the first regions where it was rolled out. In the UK and Australia, it's also been tried. And there, people were often placed in low-wage contract and short-term jobs, which resulted in people cycling on and off social assistance instead of being able to find work that would allow them to have enduring financial stability. And I think for the Peel region, we know from the pandemic that this kind of employment disproportionately impacts racialized people. And in Peel, we know from the L6P postal code that is home to essential workers and had among the highest positivity rate during the pandemic in Canada because of lack of paid sick days and the nature of work in factories and warehouses, that this is a concern, the model that's being used. Sorry, go ahead.
Sorry. So how do we know, are people achieving higher incomes? What are the outcomes of this? Is it achieving any greater stability for folks because of the employment services transformation?
And this is what we don't know, because there's very little data that's been published. So what we do know is about a year ago, the prototype started 2 years ago in February. A year ago, the province contracted another private firm called Goss Gilroy to conduct an evaluation. However, we don't even know if these results will be made public when they are available. So the two asks I would give to municipalities are, first of all, they should ask that the province make the results public so that there is transparency on incomes and we can see if the employment services transformation is helping people secure meaningful long-term employment and financial stability or not. And I would encourage to get those numbers at the 3, 6, 9 year mark and on. Because we know the further we go, the less people are placed in terms of time. And the other thing is municipalities should be asking for more funding for wraparound services and stability supports, including interpretation services in languages other than English spoken in Peel, such as Punjabi, Italian, Mandarin, Cantonese, and Arabic. And this will ensure that people can understand what's going on with the transformation process and also become job ready.
So do folks that don't speak English and speak those other languages, do they not have access to this program?
What we hear in the clinic system is that a lot of things that are placed on the web or are public materials that are not translated, people have really no understanding of what's going on, either with the social assistance renewal, which is one wing of the modernization, or the employment services transformation. So to meet those needs of those communities, there needs to be better linguistic services. Yeah. So
just to summarize everything that you've shared, if I can do it succinctly, the access to wraparound services and supports is difficult. And once accessed, the rates are much lower than the poverty line. As a supplement to that, we have kind of the employment services transformation, which has the goal of moving people off of social assistance and on to employment. However, there's no evidence, we don't have data to show whether the jobs that are created from that program are lasting or are long-term or are sustaining for these folks that are part of the program. So that's the landscape that we're working with. You've got it. And I would just say to municipalities, you don't have to choose between rates and wraparound services. Social assistance recipients need both. And so I think to advocate for both so that people can be lifted out of poverty is essential. Yeah, well, thank you so much, Deborah. This has been really eye-opening and really interesting. I can tell you're really passionate and so knowledgeable about this topic. So thank you for sharing. And I think this is a lot of information and a great thing for folks to keep in mind as they're heading to the polls later this month. Thank you, Christy. Thanks.
Thank you both, Deborah and Christy. What an interesting concepts that were discussed, and I learned a lot. To be honest, this is not the area that I primarily focus on. My area is mostly homelessness and housing, but you know, these are all factors that apply to discussion around social assistance, because what I often hear is it's either rent or food, and no one should have to live like that. No one should have to worry about. These are basic needs. People should have access to basic needs, and as it was said during the discussion, advocacy is really important. Advocating for issues that may be more provincially attached can always be done by people at the municipal level, and then the one thing that we were always talking about is how governments do need to work together to make a lot of these things, just raise the quality of life in general. So, but it's really helpful to understand what is happening around the area of social assistance, and I had no idea about the employment services transformation. You're absolutely right. I have not heard anything. And I do recall when COVID was happening, one thing that stuck out in my mind was the lack of paid sick days for a lot of the workers that lived in the area code that Deborah had brought up. So lots of really good information, and thank you for sharing that link, Deborah. So I just want to remind everybody that you can put questions in the chat. Please keep them coming. I've already seen a few come in around housing. So yeah, please, we want to have a good just Q&A at the end of this. And I'm seeing a lot of really good and thoughtful questions come in. So now we are going to move on to our the last section in our final discussion. Peel is by not any measure resourced in the way that reflects equity with other regions or the needs of the community. People in Peel have about 50% less access to emergency care than most regions. Peel schools have 6 to 10% less in funding per student than other GTA municipalities. And Peel has less than 1/10 of the provincial youth outreach workers Toronto has. These shortfalls affect some communities more than others, and racialized and marginalized groups are clearly impacted by these issues. So our final discussion on equity will be introduced and moderated by Gurpreet Malhotra from Indus Community Services, and Angela Carter, and who will talk about the issue of equity.
Terrific. Thank you. Thank you very much, Daphna. Good evening, everyone. My name is Gurpreet Malhotra. I'm from Indus Community Services. Equity and the lack of it joined the pandemic on the center stage of our minds over the last 2 years. Unlike lockdowns and vaccination lines, building an equitable service system in Peel is going to be ongoing work. I'm pleased to be able to discuss some of the aspects of equity with an advocate, a dear friend, and a dedicated professional, Angela Carter. Angela is the Executive Director of Roots Community Services, a charitable multi-service organization that provides services and programs primarily to the Black, African, and Caribbean communities in the regions of Peel and Halton. In this role, she advocates for the upliftment of these communities. She works tirelessly with community partners to dismantle anti-Black and other forms of racism and break down systemic barriers that continue to negatively affect all racialized and marginalized people. Welcome, Angela.
Thank you, Gurpreet. Thank you. And don't forget our Anti-Black Racism and Systemic Discrimination Collective.
Yes,
we are both co-chair.
We're both co-chairs along with Varsha,
yes.
and are proud of the work on the Anti-Black Racism and Systemic Discrimination Collective table. On our first question, Peel is one of the key centers of immigration and has a significant population of racialized people. Angela, are we seeing the equitable investments in health, education, and housing that are required to meet the needs of our community?
No. As you heard Daphna read just now, we are 1/10 of this and half of that, and what we're receiving is totally inadequate. And we see it every day in the work we do. And I know we always advocate and we always talk about, especially in the healthcare system, is it $1 million shortfall each year that we don't get compared to others? That's Brampton and Mississauga is 900 and something. We haven't seen that change really yet. So we are always operating way behind. And the big problem is we are a center for immigration. We continuously have growth, within our region, but our growth is far outpacing the services we get. And we need counselors, both at the regional and local level, to be able to advocate more strongly for us in this. Our municipalities actually are responsible for the ambulance and for childcare and for public health, social services, social housing. That's what they need to be advocating to the provincial government and really making it clear that we cannot operate on, on such meager funds each year, because who is suffering? Our citizens are suffering.
Yeah, it's often said that the people that are listening to this and that live in our communities all pay their fair share in taxes, and there's no logical reason why they receive so little back from each of those systems. There's definitely an inequity there. Angela, during the pandemic itself, we got a stark reminder of these inequities in our community. Can you tell us about how racialized communities were disproportionately impacted and continue to be, and what worked in addressing those inequities?
Well, the last 2.5, almost 3 years have been really grueling here in Peel region. At one stage, we were considered to be the hot spot in across Ontario with regards to the number of cases. And the reason why, going back to all of those inequities we spoke about not long ago, that the housing spoke about, that the income security spoke about, and that we are seeing here. We saw at the outset that racialized groups were so disproportionately affected, negatively affected, right at the onset. Reason why? We are in the jobs and low-paying jobs, number one. Many of us are in the as personal support workers within the long-term care homes that were were affected significantly at the onset. You know, many of them, as I said, being in low-paying jobs, they work from day to day. So if they miss a day from work, that's a day's pay lost. How many of them can afford that because they work in 2 and 3 different jobs? So we know all of these things, why this happened at the onset. And, you know, thank God for the 6 lead agencies that worked in the high priority community strategy initiative that came together and worked long hours, day in, day night, with some community ambassadors from each of our various communities that went deep into the various communities to work to help people to understand, to bring them PPEs, to help them to become, to protect themselves better, to provide them with places, you know, how to get to isolation center, or even if they have to isolate at home, what do they need, carrying food, doing so much to make sure that our communities don't see that loss that we saw right at the beginning. And unfortunately, it was hard. I read just recently a report from StatScan on the COVID-19 mortality among racialized population. And what they said was, yes, the racialized population had a higher mortality rate. And when it was associated with income, it was worse. So those who in low income had a much higher mortality rate. Unfortunately, and what's new, as I would say, because I say we always have the highest negatives and the lowest positives, that's the Black, African, and Caribbean communities. They showed that it revealed that Black people had the highest age standardized COVID-19 mortality rate of 49 deaths per 100,000, followed by South Asians, 31 deaths per 100,000, Chinese and the white populations were 22 deaths per 100,000. Why is that? You know, we saw with our own eyes because we were there right in the trenches working all the time. So we need to always look at, and they said, you know, that ratio between the racialized groups and the low income was significant. So the lower your income, the more you were at risk of dying from COVID-19. So we saw it. So all of these things are intersectional. You know, the poor housing, low income, you know, poor paying jobs. What do? It is definitely a major impact. We want our councillors, we want those who we elect to understand the severity of this situation, that they not just go to council to say, I'm a councillor now and I can pass a bylaw and I can change a street sign. We don't want just that. We want them to really get in the trenches and understand what is happening with the citizens of this region.
Angela, I think you highlight the compounding of inequities. what happens as they build on top of each other. So racism creating an inequity, poor housing creating a different inequity, access to jobs that don't have as good benefits or sick time, compounding and piling those on and on, not having services in place that are able to properly, for example, in healthcare, track cardiovascular disease or diabetes, not have supports around mental health that is culturally appropriate and accessible and able to support a community, and you keep putting those on.
Yes.
As you were in the first part of your answer, you were talking about those early days of COVID and our community
Yes.
health ambassadors going out into the neighborhood. Just a reminder, this is pre-vaccination.
Yes.
These staff were bravely going forward into neighborhoods, knocking on doors, standing in front of grocery stores, handing out PPE kits that would fit a turban or fit a hijab, and supporting families to as the vaccination became available, to feel comfortable getting that vaccination. That was heroic work.
Of course it was.
And
Yes.
all the more necessary because of the inequities.
Of course. And they did a human job, because with all of that, and with then the vaccine coming on, we became one of the highest vaccinated regions. And it was because of the CAs going out. It was because of the work we did and how we work, not forcing people to take the vaccine, because that's one thing we said we weren't going to do, but working with them to help them stay safe and help them protect themselves and their families. And that work continues right now. Again, we still need more funds. We know how it is, how long we had to wait for funding to come through for us to continue doing that work for our community. Our ambassadors are now going out to ensure that people get their screenings that they didn't do for the last 3 years. They get their tests done. Why? Because now people are presented with later stage diseases due to that the lockdown. But we need to get them out there again. But we need support. We need funding. We need resources to do this work and keep our communities healthy.
No, agreed, and I also agree that the regional councillors and the like have an important role to play to petition senior levels of government to bring the fair share back into the region as it generates those taxes. It needs to receive those services. There's no good reason why it doesn't happen. For my last question, Angela, other municipalities have created policies that ensure that budget decisions, policy plans, regulations, they're all assessed using an equity lens. How would something like that affect the people in Peel region if we looked at everything through an equity lens, as it came to budgets and policy, et cetera?
We must do that. And I know that the various, the two cities and town and the one town, they do have DEI programs. They do have the city of Brampton has an equity office. I know the Mississauga has their workforce diversity inclusion strategy and team, and the tongue of Caledon, they've also held they have a DEI program, and they've held some round tables, and we need to encourage them. They need to continuously hearing from the community, not just one time. And they need to make sure that when they're developing policies, that they have the input from our communities. I've done some research and see that others, what they're doing is not just having line items, but changing it to look at the services that they're actually providing. So budget is based on services and the impact. Who is benefiting from that? Is it widespread? Do they have to even target some more to others? So they need to hear from the communities. They hear from the citizens and the residents to help inform their budget, the budget plans. They can't just say, oh, continue with, oh, line item, this is what this line item, without having a correlation or connection to the citizen. Yes, okay, we're going to have $2 million for parks and recs. Okay, what does that mean? Who is really benefiting from parks and recs? Okay, we know it's a great benefit, right? But how are they measuring that? Do they get the feedback to say what activities they have in the rec centers are the ones that people want to go to? They must listen to the thing, and not just, put something on up there and say, oh, you can read it and send in your comments. They leave out a large portion of people when they do that. They need to have a more concentrated way of engaging with the community, with their residents, to say, how does this work? And not just wait till a month before budget. As soon as one budget is done, start those conversations. Have bi-monthly, quarterly sessions with the and engage people. Don't, that's what it takes for them to really have an equity lens. Saying that you have yes, they have DEI programs and they have this, but do you really have an equity lens? Are you taking off or looking through or wiping your eyes to make sure that you're not focused just on one area all the time? Turn your head to see other areas and ask the questions, get people involved in a number of different ways. Just don't use one way and say on the website, we have this, you can go and pull it down, and no, find other ways to engage our kids. That's what an equity lens is about. Lenses, not just one. They need equity lenses because equity comes in different forms, and they need to see equity in a number of different ways.
I think that's really, really wise, Angela. The idea that the councillors or prospective politicians and leaders across our communities, including school trustees, need to be able to try extra hard to hear the people they normally don't hear, to not just attend to those who happen to have the loudest voice and are used to being heard, but it's much more important to go further into the neighborhood to actually hear what the person in the park would like to see happen, what the person at the rec center, or the person who's never been to the local community pool. What are the reasons? What can be done to get them better engaged, especially as we see all these things interact. Healthcare funding from a provincial level, and then there's also discussions around how doctors should be able to give you a social prescription so that you join a walking club or get involved with biking on one of our local trails, or that sort of activity, how beneficial it is. We all know it. The last couple of years in the lockdowns, we all felt that lack of connection that one needs to build a better community, and so I think your words are particularly wise for a prospective leader to understand. They need to be able to get out there so that their rules, their regulations, their policies, their bylaws, their budget properly reflects the needs of the communities they serve and the communities that they now lead. So they
probably need to go have walkabouts with the community ambassadors.
Yeah. Yes. Yes. and I dare go so far as to say that to anyone who's looking to become one of our political leaders, that please reach out to the nonprofit sector, whether that be arts or sports or human services, social services, health. Please connect to us. As a sector, we would be happy to take you on such a walkabout, and I think you would gain a great deal by seeing the community from our various perspectives. This is great. Thank you so much, Angela, for your invaluable expertise and your terrific insight. I'm gonna pass it back now to Daphna Nussbaum, our MC, and Daphna, you can take us on to the next stage.
Thank you.
Thank you both. That was a very incredible and rich discussion. So many good points raised, and I love the idea of equity lenses. I think I also echo the notion of talking to the people who are experiencing these issues rather than assuming what the this is one way of getting to understand what's going on, but another way is to actually talk to the people who are experiencing all of this, whether it's someone who is living rough, or someone who may be using a food bank, or somebody who is part of the community that Angela and Gurpreet are discussing. You're never going to know until you speak to the people with lived experience. And those are the voices that we are raising here, and those are the voices that we need to continue raising. So I just want to make, congratulations to all the candidates for getting into this field. But it's really important to listen to the people that are being affected by all of this. So I guess I'm just going to say, keep it in mind. So now we are going to go on to the Q&A portion. I have gotten some questions throughout the chat. If we don't mind, I would like to ask the panelists one question, and I'd love for each of you to answer it, and then we're going to go on to the Q&A from the audience, just because I think it's important that we, provide a call to action. So the main call to action is, of course, to go out and vote in the municipal election. But my question to the panelists, and we can start with Angela and then Laura and then Doug. What is your call to action? What do you want voters and candidates to take away from this evening, this event? So Angela, if you don't mind asking first.
What I would like the voters to take away is to go and do some more research as well. Learn what the municipalities or cities are responsible for, because I don't think a lot of people know what they are responsible for. What's the difference? Everybody looks, primarily, not everybody, but a lot of people look to provincial government and think it's, the provincial government drives everything. Well, yes, the provincial government has, and they release the purse strings in a number of cases, but the regional and municipal government, local government, they're responsible for a lot of stuff that affect us on a day-to-day basis. And we need to hold our councillors accountable for those things. Yes, the money is raised through taxes, etc., and other things, but and some come from the other levels of government. So what is it that we, the councillors, the local government, is responsible for? We should know, and we should know and ask questions of our people that we plan to vote for. How are you planning on working on this, or what are your views on that? We have 20 days now. Find one councillor, find somebody within your area, a councillor, and ask them the question. Even if you don't talk to everyone, find one of them, the one you think you're going to vote for, and ask them those questions. Hold them accountable.
Thank you. Thanks so much. Deborah.
Thanks. Yeah, the one thing, sorry, I think the one thing I'd like people to go away with is an understanding that we have a labor shortage right now, right? So I think at least the provincial government is of this view that if you go and get a job, life will sort itself out. So what we know is if we still have a labor shortage and we still have the caseloads that we do have on, I'll talk about Ontario Works first, that means that there are significant barriers to people being able to both secure and maintain work. And so if people do not have a lived understanding of the difficulty of securing and maintaining work when you do not have a safe, adequate, and affordable house or home to live in, when you do not have money for food, when, as one person I've spoken to said, they are too poor to pay for the public transit to go to the food bank to get the food. These are the kind of situations of destitution that people are living in. And so I think municipalities are powerful, and they need to be speaking in conversation, advocating strongly with the province to get funding for these services. And transit is municipal, so they need to be looking at free and accessible transit. For people with disabilities who are, some will be able to work and some will never be able to work, there needs to be a real understanding of how the world is not built for people with disabilities, but that doesn't mean that they cannot contribute and be fully engaged in their communities. So I would say to people, speak to people in these situations if you can. Ask them what their barriers are. Ask people with disabilities how they'd like to contribute. Ask them what kind of accommodation they need in the workplace to be able to contribute, and have a better understanding of that so that you know what kind of programs to design and and why it is so paramount that we raise incomes to start. Nothing is going to happen if we don't raise the incomes to start.